Hello everyone, I'm Digital Correspondent Sarah Macias with Real News Communications Network. Today we're here with Dr. Johnson with Johnson Medical Associates. We're talking about concussions. Now Dr. Johnson, I've worked with you on a couple of stories that have to do with younger people having concussions. There's a treatment out there that you're going to tell us about that helps these concussion patients recover a lot faster. Tell us about it.
Yes, recent studies have been done with acute concussions and hyperbaric treatment. And hyperbaric is where a person is placed in a chamber, breathing 100% oxygen under pressure, which fully saturates the blood vessel and delivers up to 10 times greater oxygen to the tissues of your body. The tissues that have been damaged then heal faster. And recent studies have shown that in acute concussion, 80% of the patients recover after 1 hour a day of hyperbaric for 3 to 5 days. Now, there's some that are longer than that, but that's a marked improvement from the average of 12 to 13 days recovery time without hyperbaric and just normal concussion protocol treatment of keeping them quiet, moderate activity, low light, low stimulation type situation.
Now, when I was talking to the teens that I've done stories with, they tell me that a lot of their symptoms go away after doing hyperbaric treatment. They don't get as many headaches or as lingering headaches. And tell me how that's
exactly.
Possible.
And concussions are basically based on symptoms. Structural testing is grossly inadequate for telling about the concussions at the present time. So concussions are based upon either a questionnaire or some tests that look at eye movement or balance. There's a little program that you can download free for the individual called HIT Check, H-I-T check mark, or C-H-E-C-K. Parents can have their kids do that prior to participating in sports, and then if they do get hit in the head or some type of trauma, you can repeat it and see whether there's a change. And it can help you really evaluate on a factual, quantitative basis the effect of what that head trauma has done and whether it classifies as a concussion or not. Many times kids have a trauma to their head, either playing soccer or hockey or football or whatever, baseball even, what the sport may be, and they don't realize and won't say anything but are acting different. Mm-hmm. So it's important to pay attention to the symptoms and how the kid is acting if they're in the sports and have had some type of trauma to the head.
Mm-hmm. And you've experienced many coaches who are looking at brain injuries in a different light now that they know about hyperbaric treatment. Is that right?
Correct. Not only from the aspect of doing hyperbaric sooner and getting them into treatment so they can recover quicker, get back to school, function at a higher level, and then hopefully get back to playing sports quicker. The big issue is how soon to send them back, because we know a second concussion, a third concussion, fourth concussion is much more likely and easier to occur with a head hit. So you want to get them healed up, give them the time to normalize, the brain to normalize, and then get back to healthy living.
All right. And before we go, tell us briefly about the type of patients that you've seen come to your office recently with concussions.
The ones I see all types, but the ones we see is acute concussions, that people are aware of what hyperbaric does and how quickly they typically recover in most instances within 1 hour, 3 to 5 days in a row. The other is people that have had concussions that just aren't recovering, that are persistent. And those are ones that are looking to try to feel better, get back to functioning. And they may be non-functioning for 6 months or more with headaches, fatigue, difficulty with their memory and thought processes. Those people take a little longer in treatment, but most of them do improve and get back to normal functioning. Recently, I had a basketball player that had a basketball type concussion, and he'd been out for over a year, and now he's back functioning, playing ball again, where he couldn't, and it's had to do with a concussion, months ago.
And that's actually one of the reasons why we're not in the hyperbaric treatment area, because it's so full right now. There's a lot of people who are taking advantage of the treatment and realizing that how quick that they're recovering. So if anyone out there, has a concussion or knows someone who does, they can get a hold of you through your website. Tell us your website and the phone number they can call.
Yes, Johnson Medical Associates at 972-479-0400. Or you go to the website Hyperbaric Centers of Texas, and it has additional information. That's Hyperbaric Centers of Texas.
Perfect. Well, thank you, Dr. Johnson.
Thank you.